Good afternoon.
Hi, I'm Peg Devine. I'm the school nurse at Lincoln High School, and I want to thank you for the opportunity to give testimony today. I'm currently serving on the executive board of the Philadelphia Federation of Teachers. I am a member of the School Nurse Practice Committee, the Committee for Professional Standards for the School District of Philadelphia. I'm a member of PASNAP, which is the Pennsylvania Association of School Nurses and Practitioners, and a member of the National Association of School Nurses. I'm here today to discuss the impact of the budget cuts on the school nurse service in Philadelphia and the effects these cuts have had on our most precious resource, our children. School nurses in Pennsylvania are licensed and are required to hold professional certification in accordance with the Public School Code, which was enacted in 1949. And just as a point of clarification, Donna Cooper earlier suggested that we have the health centers provide the nurse service to the schools, and part of the school code says that school nurse service shall be provided through the public school system, and administration of this is the responsibility of the school district. So that's right in the school code. The certified school nurse provides school-based services to all students, not just those who are covered with health insurance companies. The school nurse performs mandated screenings that are required under the school code, including growth and vision screening annually from kindergarten through 12th grade. Screening for hearing is done in grades K through 3, 6th and 9th, and scoliosis screening is done in 6th and 7th grade. The state mandate also requires school nurses to plan for and administer first aid services and to instruct personnel who are responsible for administering the first aid in the absence of the school nurse. In 1975, when Congress passed the Education for All Handicapped Children Act, the role of the school nurse became even more essential. IDEA guarantees that all children with disabilities have a free and appropriate public education in the least restrictive environment. Today, the certified school nurse's duties include many nursing procedures beyond administering medication orally, such as blood glucose monitoring, insulin administration, providing rectal Valium, administration of medication by way of gastric tubes, nasogastric tubes, tracheal suctioning, and catheterizations, just to name a few. The nurse develops individualized healthcare plans for each of the medically fragile students. The nurse collaborates with the faculty and staff to remove barriers so that these students are ready to learn. They may create 504 service agreements to accommodate the students who are protected under the Office of Civil Rights, or they participate in writing the individual education plan necessary for the medical and nursing components for the students. School nurses maintain confidential health records on every student. These records include past medical and surgical histories, any known allergies, any medication the student is taking. Gathering the health information includes documenting the physical exams, which are required by law, entering school, entering middle school, and entering high school here in Philadelphia. Monitoring and documenting the immunizations of each child that they have received, and that the information is then shared with the state at the Department of Health annually. The state of Pennsylvania requires the school district to hire the school nurses for one school nurse for every 1,500 students. And please remember that this law was enacted prior to IDEA and the inclusion of individuals with disabilities in the least restrictive environment. The National Association of School Nurses recommends a ratio of one nurse to every 750 students. In Philadelphia, this ratio was maintained prior to the layoffs. At that time, Philadelphia was nationally recognized for the excellent compliance that we had in reference to our immunization compliance rate. Today, our immunization is much lower. When the nurse is not in the building, the students are registered, and there is a much greater chance that they'd be allowed to enter the building without being properly immunized. Our most fragile students are receiving inconsistent care from non-medical staff who have been given basic instruction on how to keep them safe. Any principal is capable of walking into a classroom and teaching because of their educational background. The same cannot be said when they are expected to act as the nurse in the building because they don't have the same skill set. Yet since the budget cuts, they are expected to handle all emergencies and administer medication when the nurse is assigned to a different building. In the absence of the nurse, medications are sometimes mismanaged. Students are given asthma inhalers without a nursing assessment to determine if the medication is in fact needed. The risk of medication errors increases, especially missed doses, and far too often they are not documented, and it's not documented who has administered the medication. Students who are assessed by the school nurse are often able to remain in school after they receive a dose of Tylenol or ibuprofen, but these same students are sent home in the absence of the school nurse. The most tragic example of what can occur when a nurse is not present is all too familiar to the school nurses of Philadelphia. LaPortia Massey, who died as a result of an asthma attack, spent much of the day in the school office, where the nurse was not assigned that day and hadn't been 2 days prior. So she was waiting for someone to recognize her distress and care for her. Had a nurse been present, she would have listened to the child's lungs with her stethoscope or his stethoscope and immediately recognized the danger. Today, far too frequently, students are sent home with minor injuries, and principals will err on the side of caution and call fire rescue to escort the child to the hospital for care that would have been handled easily by the school nurse had she been present. This places an unnecessary burden on the EMS system, and parents are strapped with exorbitant bills for these services. Another direct result of having these unfair budget cuts is fewer staff to monitor lunchrooms, halls, and recess yards, leading to more injuries sustained by students who have less supervision. This causes an increase in visits to the health room. Consequently, increased visits to the nurse result in less time for the nurse to perform mandated screenings, difficulty in managing the health records, more difficulty monitoring immunization compliance, and inadequate time to accomplish health-related teaching, among several other tasks. Another population that is unduly burdened by the budget cuts are the diabetic students. The diagnosis of diabetes is devastating to families. The number of cases of this life-threatening condition has risen dramatically, and these students deserve the protection of a certified school nurse all day, every day, while they're in school. The school district has opted to provide outside agencies to provide nurse service to come to the school on a part-time basis to monitor the blood sugar of these fragile students. They count the carbohydrates that the student has eaten, and they administer insulin accordingly. The risk the agency nurses that they may not show up is very real, and when they do come to school, there is no consistency, and as a result, no relationship develops between the child and the nurse. As a result, subtle changes in the child's affect or behavior that would have been recognized by the certified school nurse are often missed. The practice also makes a very dangerous assumption that the diabetic student will have no variation in the blood sugar levels when the nurse is not present. Another undesirable alternative being offered to families is to have their child transferred to a school farther from home where there is a nurse present every day. This is unacceptable to families who have already been devastated by the diagnosis, along with all the other life-changing consequences that go with this disease. Working with community partners such as the Eagle Eye Mobile and Oral Health Impact Project have seen reductions in the number of students served because when the school nurse is not present in the building, they are unable to coordinate these services as effectively. When a nurse is not in the building, they are unable to participate in the IEP and the 504 meetings for medically fragile students, and the vital input regarding the student's health history is often missing. Case management is challenging when the nurse is responsible for 1,500 students on a daily basis, and when these students are spread over multiple buildings, it's next to impossible to provide safe care. As certified education specialists, school nurses are also charged with developing health and wellness programs for their schools. This is virtually impossible to do with the current staffing ratios. Our children deserve and need so much more. I respectfully ask that this committee heed the recommendation of the National Association of School Nurses to seek adequate funding to provide a certified school nurse at a ratio of 750 students to one school nurse. Thank you.
Thank you so much. Ms. Duffey?
Good afternoon. My name is Eileen Duffey. I'm a certified school nurse at the Academy at Palumbo and at the Allen M. Stern School in Frankfurt. I have worked as a pediatric nurse for over 30 years, 21 in the School District of Philadelphia. My prior experience includes 15 years working at Children's Hospital of Philadelphia and the University of Pennsylvania. I thank you for inviting me here today to discuss the impact of the budget cuts on essential services to our vulnerable school population. In many regards, the information Peg Devine and I provide today is not new. We, among other nurses, have remained consistent, outspoken proponents for the rights of our students to a certified school nurse from the moment the nurse layoffs took effect in December 2011. We have done so in op-eds, letters to the editor, on the radio, at community meetings, in a photography exhibit, at weekly rallies for 6 consecutive months, and at countless School Reform Commission meetings. We brought national attention to the Philadelphia school children's unmet needs when a child died as a result of an asthma attack that occurred in a school where no nurse was on duty. We nurses have advocated for our students at risk to our jobs, as speaking up has put us at odds with the school district administration. It can reasonably be stated that we have left no stone unturned in our persistence in advocating for our students' rights to essential school health services performed by certified school nurses. I have been requested to speak on the impact of the reduced funding on the services my colleague described a few minutes ago. While much warranted hand-wringing has occurred regarding the times there is not a nurse in the school, I would like to make it clear that the doubling and sometimes tripling of our caseloads, up to 1,500 students to each nurse, has wreaked havoc on the quality of services each nurse provides in the day the nurse is in the building. Each school nurse finds herself in a professional double-bind situation in which doing one essential service results in not providing another essential service. Hence, mandated screenings may get done, while non-compliant immunization follow-up calls do not get done. Chapter 15504 service plans may get done, while mandated physicals do not get documented. Documentation of myriad visits to the health room simply cannot be comprehensive, leading to poor records and leaving the district open to medical liability. Most school district nurses agree that it takes about 3 years for a qualified certified school nurse to reach her stride after leaving a clinical setting in which a medical model is used and entering a school setting in which she is the only medical professional in the building. Long before the draconian budget cuts, we nurses commiserated about the responsibility we felt adequately addressing the mandated professional duties enumerated by my colleague earlier today. We had professional meetings several times a year in which we shared best practices, honed our skills, and supported one another in our difficult but rewarding jobs serving Philadelphia's children. Our passion for this work is unmatched. But let me be abundantly clear here. Before 2011, we were able to get our job done. Before 2011, our quality Philadelphia School Health Program was nationally recognized. In fact, prior to the 2011 budget cuts, school nurses were rarely in the news, precisely because adequate, well-functioning school nurse services did not constitute a newsworthy topic. In spite of our vigilance, perhaps because of our persistence, the School District of Philadelphia administration has sidestepped the school district nurses on numerous occasions in their attempts to provide school health services on the cheap. Bureaucrats who are not professional certified school nurses have on numerous occasions suggested simplistic, half-baked solutions to meeting what they perceive to be the health needs of Philadelphia's children. Time and again, their shoot-from-the-hip solutions ignore the Pennsylvania School Code and the complicated needs certified school nurses are ably prepared to meet. I would add that medical professionals, however prestigious their pedigree, who do not hold the school nurse certification are not the appropriate persons to weigh in on issues of school health. As a case in point, no one here who suffered a brain tumor would seek the expertise of an orthopedic surgeon to perform a delicate brain surgery. One of the solutions put forth by non-experts is to think an innovative, quote-unquote, idea is to engage in partnerships with area universities. This idea is not innovative at all. In fact, long before the word partnership became code for abdication of financial responsibility, school health services have been engaged in university partnerships to supplement health-related services. No partnership can be effective when engaged without the direct cooperation of the certified school nurse. All partnerships require more, not less, work on the part of the school nurse. Current partnerships such as vision and dental are experiencing the jarring recognition of this fact as they seek to provide services in schools without a school nurse on site. If I can leave you with just one realization after hearing my remarks today, please disabuse yourselves of any thoughts that vital school services can be done by anyone other than a certified school nurse. And restoration of adequate school nurses should be a priority in the next school budget. Thank you for inviting me to speak to this assembly today.
Thank you. I just want to acknowledge Ms. Devine, Ms. Duffey, for doing a yeoman's work and heroic work around raising attention to the issue of school nurses. This issue would not reach the level that it had it not been for your organizing, activism, and passion for this issue. I know that we have another panel, but I just had a few very quick clarifying questions for you. Ms. Devine, are you the only school nurse at Lincoln High School?
I am the full-time school nurse at Lincoln High School, and as of 2 weeks ago, I was given a nurse 2 days a week as an assist nurse to work with me.
A certified school nurse?
Yes, another certified school nurse.
And then prior to that, how many students are at Lincoln High School?
1,500.
Okay. All right. Thank you very much. And then, Ms. Duffey, who mandates physicals? State or city, or
State.
who's the mandate?
The state.
Okay. And is it I think some of the testimony that came out today raises some serious questions about whether the School District of Philadelphia, again, is in violation of state law in terms of delivery of records, in terms of whether physicals are being mandated, in terms of 504 plans, and we will continue to follow that up. I do want to make sure that both your testimonies are